Winefordner, and today I'm presenting on scoliosis. So what is scoliosis? So according to Johns Hopkins Medicine, scoliosis is the curvature of the spine, which can be measured in an x-ray at 10 degrees or more, and it is typically in a C or an S shape. It affects the musculoskeletal system, which has the muscle, skeleton, and nervous system. And it affects all ages, but is most commonly found in 10 to 15-year-olds. And it affects 2 to 3% of the worldwide population. In the United States, it affects around 6 to 9 million people. So, with information found from the Cleveland Clinic, there are 3 types of how scoliosis develops, and then 4 types of scoliosis on where it affects the spine, like locationally. So, the first type is idiopathic, which is the most common type of scoliosis, but the most unknown to doctors type of scoliosis, because it's unknown how it develops or why it develops, and it can develop anytime and at any age. And then congenital, which is due to birth abnormalities in spinal development, and this is typically detected directly after birth or at most a couple months after birth. And then neuromuscular, which is from underlying neurological or muscular conditions. And then there are 4 types of scoliosis on where it affects the spine. So there's thoracic, which affects the top part of the spine, lumbar, which affects the lower part of the spine, thoracolumbar, which affects the middle part, and then combined scoliosis, which affects the top and the bottom part of the spine. So how does scoliosis affect the body? And this is with information found from the NYSI. So there are many different ways that it can affect the body, but the 4 most common is physical changes, which means uneven shoulders, hips, and rib cage. And then here is a picture of scoliosis posture symptoms with the ones that we just talked about: uneven waist, hips, shoulders, the obviously curved spine, and then predominant shoulder blades. And then it also causes pain and discomfort, and this can be chronic back pain, painful legs, which can affect walking patterns. And hand in hand, it goes with postural disturbances, which is found from this study that was conducted about how scoliosis affects adolescents compared to other factors like nutrition, physical activity. And they found that scoliosis can affect flat-footedness, and then metatarsal varus, which is basically just something that happens with the foot on the ability for it to hit the ground normally. And then breathing difficulties, because when the spine curves, it can reduce lung capacity due to compressing the lungs. And then just some pictures based off the last slide. Here is a standing assessment and then a forward bending assessment of someone with scoliosis. And again, it just highlights uneven hips, shoulders, waist, the predominant shoulder blade, and then obviously the visible curve of the spine. And then here, obviously, back raised on one time on one side, and the obvious slant and the spine curved. And then with the lung capacity, this is a picture of someone with scoliosis, and then after it was surgically treated, and you can see in the different green and red highlighted areas that after scoliosis was treated in surgery, the lungs were a lot more fuller and a lot better at being able to take in oxygen. So what are possible treatment, prevention, or managements of scoliosis? And this is from information from the AANS. So there's 4 different types of ways that you can treat, prevent, or manage scoliosis. The most common type is just through observation, and this is for scoliosis that isn't severe enough where it's needed to have any of the other 3 that I'm going to be talking about. But observation is basically just monitoring every 3 to 12 months. And if scoliosis gets a little bit more severe, another option is bracing. And this is a picture of a typical scoliosis brace. And bracing is more of a management type instead of a treatment or prevention, because the brace is not expected to actually treat the scoliosis. It's expected to prevent further progression of the lateral spine curve. So it basically just keeps scoliosis where it is, because this part is hard and it doesn't allow it to get any more severe, but it doesn't really help it get any better. And then two other ways that it can help with treatment management or prevention is through physical therapy, and this can be through core and back exercises to help strengthen the muscles, which can then be stronger to like get the spine back into the correct positioning. And that can be like also exercises could be like posture strengthening or walking exercises to help it be more comfortable. And then if scoliosis is severe enough, another way that can be treated is through surgery, which typically involves spinal fusion with instrumentation. And then here's an image of a patient before with the obvious combined scoliosis, and then after it was surgically treated. And you can see the spine with the help of these instruments is straighter, and it helps with like the lung capacity and the painful back and the like asymmetry. Here are my references. Thank you.